Hi, my name is Judie VanKooiman, and you're watching Life Issues. This month's show is about East Boston Neighborhood Health Center and the Neighborhood PACE program. My guests are Amy Goldberg, Bobby Lozzi, and Sue Sobeski. Welcome, ladies.
Thank you.
You're very welcome. Amy, I'm going to start with you.
Okay.
When did the East Boston Neighborhood Health Center open?
Actually, we opened our doors in almost 50 years ago. In 2020, it'll mark 50 years.
Wow,
I know
next
it.
year.
So it's a long time.
Yeah, that's good. All these years helping people. And what is the mission statement?
So I'm just going to read this so I get it exactly right. Our mission statement at the East Boston Neighborhood Health Center is to provide easily accessible, affordable, appropriate, high-quality, personalized, coordinated primary care for all those who live and work in East Boston and surrounding communities. And that's without regard to age, income, insurance status, language, culture, or social circumstances. So it's very inviting for everyone.
Yes, very good. Thank you. And what are the services that the health center provides?
So along with many specialty programs, we have primary care doctors, we have our specialty program, preventative medicine, we have an eye clinic, a dental clinic, we have our PACE program, which is Program of All-Inclusive Care for the Elderly, and support services such as we have a program called Project Shine, and that is for support, healthcare intervention and education, and they take care of people who have had AIDS and HIV. We also have a medicated assistant pathway, we call it the MAP program, for any kind of opioid addictions. And then we have, these are just a few, a Let's Get Moving group for children and teens to keep them healthy and active.
It's very important nowadays.
Yeah,
So they're not
very.
always in front of the TV or with their electronics and stuff.
That's right.
Yeah, that's
Exactly.
good. Okay. All right. And Bobby, when did East Boston Neighborhood Health Center's Neighborhood PACE program start?
28 years ago, 1991. So we've been around a
long
few
time,
years.
too.
Yeah.
Yeah, wow. And Amy, how many towns does Neighborhood PACE serve? And are all the PACE programs the same?
So we serve 10 towns. So we started out with East Boston, Chelsea, Revere, Winthrop, Everett, and we've expanded to Melrose, Medford, Malden, Stoneham, and the Boston's North End. So 10 communities. We all are under the same type of guidelines, but every PACE program has their uniqueness to them. So we're all under the same idea umbrella of the guidelines.
Right, that's good. And Bobby, how old does a resident have to be to join PACE?
55 years and older. So a rather young crowd. 55 years and older is now considered an elderly person.
Right, right. Yeah, I remember getting AARP things
Exactly.
when I turned 50. Okay, then.
That's
But
right.
yeah, everything is different for the
Yeah.
elderly age-wise and stuff.
Yeah.
Like the senior centers, that you have to be 60 and et cetera. So,
Yeah.
Right.
Yeah. So, and Susan, how long have you been participating in PACE?
I've been a member of PACE for about little over 3 years.
Yeah.
Yes.
Okay. And why did you want to join?
Well, my sister working for PACE has always told me what a wonderful program it was, and I never wanted to make the change. And finally, I went to look at the program and see what it was about, and someone came to interview me, and I changed. I'm in the PACE program now.
It
So,
just made that little click.
yes, didn't take a minute.
Right.
Good, good. And I bet you never look back.
No, never did.
Good. And so, what is your favorite part about going?
I like to socialize with everyone that goes to PACE. I go around to tables and speak to people. Some people like to talk to you, some people don't, but I just forego that. And I'm known as the greeter in Winthrop Place, like the Walmart greeter. I'm the Winthrop greeter in Winthrop Place.
I can see you doing that.
I greet new people because it's hard for people to come into a place that they don't know anybody, and they're not familiar with the surroundings
Exactly.
and what goes on, and so I try to fill them in a little bit on that and make them feel welcome,
Right.
show them where the ladies' rooms are, and that sort of thing.
Right.
So,
Yeah, good for you. They probably think that you actually work there.
some people think I do.
Right.
They call me Miss.
That's cute.
All right. And Amy, does Neighborhood PACE take all insurances?
Yes, so Neighborhood PACE is paid for by the state and federal government. So we get payment from Medicare, Medicaid, or Mass Health, and private funds. So the goal is to make sure that everybody's able to stay in their homes safely with services and out of a nursing home. The two things that we have to stress is that someone has to have their legal status for 5 years, a green card, and they have to have a permanent address. Those two things.
Okay.
And then the insurance is something we go out, and if someone is not on Mass Health, we help them get right on that.
That's great. I'm sure big help.
Right.
Big help. And Bobby, who does a person's disciplinary team consist of, and what is that?
Okay, it's a group of people that care for that particular patient. It's the primary care provider, it's a nurse, every patient gets their own nurse, it's occupational therapy, it's physical therapy, it's respiratory therapy, it's transportation, it's home care, it's the pharmacy, it's registered dietitian. So there's a whole group of people that meet every morning to discuss patients. Wow. And this goes on daily. And they see patients, like if you get sick in the middle of the night and you need to talk to somebody, we have a nurse that's always, there's someone always on call, and they can be seen the next day by their provider, picked up, taken there, transported home afterwards. So there's always someone looking out for them, always. It's very comprehensive.
That's nice.
Yeah,
That's
it is
good to
very
have,
nice.
especially
Yeah.
for the elderly.
Yeah, absolutely.
And especially if they don't have a family member around
Right,
or something
and we
too.
come across that a lot.
Yeah.
No
And
family
And we really
member.
are, when people join the program, we really are the family. We get to be, you know, this
Exactly.
addendum to their life, and it doesn't negate the need for their own family, but they become very entwined with us.
Yeah,
I think.
absolutely.
Yeah.
Yeah,
It's
absolutely.
kind of nice.
Yeah. And Bobby, when did you start working for Neighborhood PACE?
Oh dear, many years ago. I used to work in a big hospital in Boston, and I worked there for many, many years. And a friend of mine worked for PACE, and she said, Bobby, you have to come check out this program. 2 weeks later, I was working for PACE, and that was 14 years ago. Never looked back. Wonderful, wonderful.
Good for you.
Yeah, love my job.
Yeah. Which site do you work at?
I'm actually an enrollment nurse.
Okay.
So after they get the information about the program from our enrollment staff that go out and fill them in on everything they need to know about PACE, then I'm the nurse that goes out and gets clinical eligibility for them. I make sure they're frail enough to be in our program.
All right.
I'm the next person they see.
Yeah.
Aw, that's
A
great.
friendly face, yeah.
Yeah, thank you.
Sue, do you go to the PACE program every day, and how do you get there?
I go to the PACE program 3 days a week. They have transportation that comes to pick us up, so every morning I'm ready so that when transportation drives up, here comes the bus, and
You're there.
They help me out of my house and take care of the needs, helping me get into the bus, and whatever it is that you need, they're very helpful. The drivers are and the assistants in there. So I go 3 days a week, and I think it's a wonderful place to go to at least socialize. If you don't want to do anything else, to at least be with other people is a good thing.
That's important.
Yes.
Yeah. And Bobby, how does it feel to have your sister in the PACE program?
It's very, the word would be reassuring, knowing that she's got great medical care, that she's got help in the morning to shower and dress, that she's got a place to go to be with people and not be alone and isolated, that if anything goes wrong, she has all the home care services she needs. She has a homemaker that takes care of her home. She has laundry service. She has Meals on Wheels, which, because she can't cook anymore. She has all these wonderful services. So it really is reassuring to me and Sue's son. Very reassuring to know that she's getting all this great care. I'm so pleased. Pleased.
That's good. That's good
Yeah.
to be reassured and knowing that she's being taken
Taken
care of, so to
of.
speak.
Exactly.
Yeah. And Sue, what type of activities do you participate in?
Well, I participate in most of the activities that they have, but we have a lot of activities. We have, let's see now, we have jewelry making. We make some pretty good jewelry. We also have painting, if you like to paint. We have, if you like to do crossword puzzles or any kind of puzzles, we have puzzles, we have games. If we're going on an outing somewhere, which I'm usually the first one to sign up for it, yeah, I'm there. And usually it's either to a restaurant or out to a movie, or so we can, you know, get out of the facility. Some people don't get out of their own homes and just come to the facility, so sometimes they'll go to that. And it's the only thing I say to other people, because I'm a participant, is there are no worries here. No worries. None at all. So.
Good.
And she's learning Spanish
Oh,
at
yes.
our wellness
Ooh, I
center.
am a taking
Learning
Spanish.
Spanish.
I can count to 10 in Spanish.
Well, I can say my phone number in Spanish, but I can't remember it in English.
You mentioned about the outings. What type of outings do you go on?
We usually go in the summertime when they have the sand castles. We take a group out to the sand castles, and a lot of times we go to one of the places on the beach to eat and look at the sand castles. Other places we go to are certain restaurants that people like to go to, you know, favorite restaurants of theirs. Like I said, the movie theater is one. We've been to, we go to the dollar store, for instance, or we've been to Walmart on outings, and people enjoy all of that because a lot of people, like I said, don't get to do those
Exactly.
things, and
Right.
so it means a lot to them. It really does, and I think they feel very safe because of how it's all arranged, and you know how they put it all together, and it's we have wonderful babysitters, if you will, that will help whatever your needs are. They're there and willing to help you.
Yeah. I've never been to the sandcastle, but I think
Oh, dear,
next
you
month.
have to
You
go.
Yeah, next month.
Yeah.
They're
I think we're
very
going.
special, yeah.
Yeah, so looking forward to
Yeah,
it. But it's
July,
always
I
been,
think
you know,
they
the
are.
traffic and all that.
Yeah.
But I think
It's a lot of
walk down from somewhere and
Yeah.
everything. So.
Oh, you have to see them.
Yeah,
They're
yeah.
really
Amazing.
great.
I've driven by after the fact
Yeah.
and stuff, but yeah, they're very interesting
Yeah.
to see after. But I want to be in the hubbub and the hustle and bustle of all the people and
Right.
stuff that's going on. So, Amy, how does one enroll in PACE if they're interested?
So basically, it's a little bit of a process. The main thing is, and we'll show the number at the end, if someone is interested in information, they can call 617-568-6377. We have a whole team of professionals that would then help you. There's no obligation anywhere along the line. So if somebody calls and they're interested, the first thing we would do is to make a visit to their home, and they would let us know the best day and time to come. And it would be one of our enrollment coordinators that would go. We also have a participant relationship specialist. That's not easy to say. And that person handles finances, and they would go out with them. So there's no obligation. They would come out to the home, explain everything, see if you're interested. If you are, then they would work on the financial piece, and they work on the medical piece to make sure you're medically qualified, because we're looking for people who need help with their activities of daily living and a skilled need. We'll determine that. And that's when it goes to Bobby, and she works on that piece of paper. And then we do our enrollments for the first of each month. So I would say it depends if someone has Mass Health in place or not. If not, then it'll be longer than a month. It could be up to 3 months, I would think.
Yeah, 2
at a
to 3
time.
months,
Yep.
yeah.
And so it just depends where you're at, financially and so forth. And if your doctor, we have our own doctors, so you would have to make a change to our doctor. And we use the Boston Medical Center as our inpatient hospital. Then we have all our specialists. So you have to be willing to make a change. But when you come out to the day center for a visit to check us out, you'll get to meet the team. And there's, again, no obligation. So you just see what you think. It's a process. We don't push anybody to enroll. We want them to feel comfortable with it.
Right. It's just like buying a car.
Yeah, we go
Try
in and
so,
out.
yeah.
Yeah.
And I always say I'm not a used car salesman because they make it sound like, the deal is off the table if you don't sign right now. But we're introducing a service, a medical service to someone. We are the insurer and the provider. So you don't need referrals. You don't need to be calling and figuring out how to get things. So we do it all under one roof.
That's nice. That's very nice. And can you please tell us about the Wellness Center?
So the Wellness Center actually has been around, I think, 3 years now.
Yeah,
I
3
couldn't believe
years.
it.
I know.
It's flying.
Yeah.
So a lot of people wanted what we call alternative care. So we built this wellness center, we call it. It's on Addison Street in East Boston. And you have to be a member of PACE to be able to attend this. But there they have the alternative therapies. So they have acupuncture, chiropractic, a massage for like chronic back issues. There's all kinds of groups that meet. There's yoga, Zumba, Tai Chi. There's a very large gym with state-of-the-art Kaiser equipment, we call it, and it's all dealt with 1/10 of a pound. You can be in a wheelchair and do it. So there's classes that meet. So it could be healthy eating or a diabetes workshop or a COPD group, chronic obstructive pulmonary disease, or just a support group in general. So they have book clubs there. They have the
Spanish
Spanish
club.
class,
They also have English
That's where you
class.
go?
English
Is that where you-
classes.
I go to the one in Revere,
Yeah.
the new facility
Yeah,
in Revere.
which
That's
is
the new site,
fabulous.
which is beautiful.
I checked
Beautiful.
that one out.
But it's the same person that teaches the English over
Yeah.
at the Wellness
So
Center.
the English class, the Spanish class,
classes, yeah.
and they have writing classes. So I mean, and they're forever adding new classes to the Wellness Center because people say, "Ooh, we'd like to learn." We have computers, so we teach them about that. There's card games. There's all kinds of fun things
Yeah,
for,
that's
for
good.
the
that
people
you
to
listen
do.
to the patients, and
Their needs.
on their,
Yep,
yeah,
and
what
their
they want to do,
requests.
and yeah,
Absolutely.
that's
I
very.
also know that they have domino, people that love to play dominoes. So they have domino tournaments
Tournaments.
over
I
at the
heard about
Wellness
Really,
that.
Center.
tournaments?
Yeah.
Yes.
I love
Yeah.
playing
They
dominoes.
love it. They love to go over there and play. So
Are
we
you
have a
old
lot-
enough to be in our program?
Yes, I am. Yeah, it's
So yeah,
a fun
it's-
game.
Yeah.
Yeah.
So it's a lot of fun.
Yeah.
But I've never heard of tournament. Interesting. Amy, what is the enrollment process like for the neighborhood PACE?
So the enrollment process is, number one, we would do that visit. Number two, if financially, they would have to financially qualify and medically qualify. Those are the things. They would make a visit to the day center so that the team can get to meet them. And if everything checked off, we're good to go, then the enrollment process would start for the first of the month. And people can disenroll at any time if they choose to, but we don't find that happening very often because once somebody's part of this family, they really don't want to leave, So I've been doing this job for 25 years. So it's a long time.
Yeah.
And I could never have stayed in a job this long that I didn't love.
Exactly. You have to love what you
Right.
do, and working with the elderly is very
That's right.
important. Yeah, that's nice. And Sue, what do you do when you are at the wellness center?
Well, lately I've been going for massage therapy. I've been for acupuncture. I've gone there for lunches. I've been there to see what the Zumba classes are like and the Tai Chi classes. So they have a lot of fun at the wellness center. They really do. They enjoy themselves over
Sounds
there.
like it.
And everybody seems to come out of there with a big smile on their face because it is fun.
Right.
They have art classes also, and arts and crafts, and all kind of other different things too. But yeah, they're the ones that I think it's really a motivational center
Right.
more than it is, a center for the elderly. To me, it's motivational.
Okay, very good. And Amy, is there anything else that you'd like to share about the Neighborhood Health Center or the PACE program?
Well, I think people should just keep in mind, be open, that if this type of a program is of interest to you, to just give us a call. That will, if it isn't right for you right now, it might be down the road. We have 3 different centers. We have one at Lewis Mall at 225 Sumner Street, and we have one in Winthrop at Sturgis Street, and we have a brand new facility that opened in Revere on Garofalo Street, and it was the old VFW. And now, if anybody ever just drove by, they would be
I know. I was
shocked
inside.
at how
I had the
fabulous.
pleasure of going inside.
It's beautiful.
Yeah.
Oh,
So-
everything there.
Yeah.
Everything.
It's all brand new,
Yeah.
state of the art. So
Yeah.
I think it's something that open enrollment is coming up soon for different health plans. So I think it's mid-October to mid-December. So this would be a good plan to explore at this time. Might be right, might not be, but at least someone might be able to tell their friend about it and that they saw it on your show on life issues, and it might pay it forward for others.
Exactly. I love pay it forwards.
Yeah.
Big heart. Yeah. So, and Bobby, is there anything that you'd like to add? That
No,
our
just that
audience?
the people that work for PACE love what they do.
Right.
They take care of our elderly patients, and they love it. They love it. Most people have been with PACE a very long time that have worked for PACE. I don't see me going anywhere. I love what I do. I love the elderly.
for
Yeah, they
you.
should give us a try.
Yeah.
Give us a try. They'll be pleasantly surprised.
Yeah. Yeah. I'm sure they would be.
Yeah.
Yeah. And Sue, is there anything that you'd like our audience to know? Anything?
I
Last
just
words?
think if people, I know when you get a little older, you don't like to make changes. The elderly don't like to make changes. And to have them do such a big thing as to change your, medical experiences, I think that it's worth the trip. Absolutely worth the trip, because I was one of those people, and I sort of wished I had done it much earlier than I did.
Yeah.
Yeah.
Of
Yeah.
course.
Yes.
Yeah.
Yeah.
So
Yeah.
I think they'll be pleasantly surprised. And like Bobby said, the staffing is tremendous. You can't find a better group of people that, and believe me, they do love their jobs. They really do. So it helps with the participants also that they do, because nobody's, grouchy or jumping at each other, or it's just a wonderful place to be. And I love it.
Yeah, that's good. That's an important thing.
Thank you.
You get to have fun where you go. And Bobby, if anyone has any questions or would like more information about the PACE program, can you give us the contact info?
Sure. 617-568-6377, and our enrollment team will answer any questions that they have and set up a home visit to be comfortable in your own home, so we can speak to you about it at your convenience. Yeah.
Okay,
And they
great.
can also access us on www.neighborhoodpace.org. If they feel more comfortable doing it on a computer, they can check us out.
Okay, great. Thank you. I'm sorry, but that's all the time that we have. Thank you for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.